Everybody to the orange stage. You've all made it. I'm Carolina Vai. I am the policy director here with CPEN and want to thank you all so much for joining this panel on challenges and issues that diverse communities face in accessing the Mental Health Services Act. The focus of this panel is to hear from 4 of the 5 local partners: Bakersfield American Indian Health Project, Visión en Compromiso, Hmong Cultural Center of Butte County, and Restorative Justice Oakland Youth, about what they learned from their listening sessions. These listening sessions focused on hearing directly from community members about how their specific communities engage with mental health and the mental health system in their regions. You're going to hear from our 5th local partner, the California Black Women's Health Project, later this afternoon. Each local partner is going to share with you the top 1 to 3 issues from their listening sessions they feel are most urgent and important to address, and what lessons they learned from making their listening sessions accessible, trauma-informed, and culturally appropriate. So Jeffrey, my tech person, if you could take the slide down and add our other panelists. Ooh, fun. I love this. Great. All right, the Brady Bunch is here. So let's go ahead and get started. We're running a little bit behind on time. So let's start with the Bakersfield American Indian Health Project, Angel and Evelyn. So if you could share your name, your pronouns, your community of focus, so who you work with, and then this first question, the top 1 to 3 issues from your listening sessions you feel are most urgent and important to address. And then I'll give you a little cue in the private chat when we need to pass it forward to Natalie.
Yeah, absolutely. Hi, everyone. Thank you, Carolina. My name is Angel Galvez. I am the Chief Executive Officer with the Bakersfield American Indian Health Project. He, him are my pronouns. And just a little bit about our services, where we're located. But before I do that, I'd like to give Evelyn the opportunity to also introduce herself. We will be co-sharing the presentation.
Hi, I'm Evelyn Eterno. I'm the Behavioral Health Director at Bakersfield American Indian Health Project.
So Bakersfield American Indian Health Project is in Bakersfield. We serve the Kern County area, which is right smack in the middle of Central California. And it's our neighboring counties would be Tulare County and Kings County, just to name a few. Some of our services, well, we predominantly serve all of the American Indian Alaska Native people here who reside in Kern County, more specifically the outlining areas of Bakersfield, like Lamont, some of the more concentrated areas where Native Americans tend to live. We have a outreach and referral medical department, and we also provide a robust mental health services for our American Indian Alaska Native people. I would have to say that from the listening sessions, really the top most priority need that we see in our community is substance use disorder, co-occurring care, psychiatric care, and housing. Unfortunately, in our area, there is a high rate of homelessness, as well as a high rate of individuals dying by suicide. More specifically, we know that in looking at the data, we see that the American Indian Alaska Native suffer the highest rate of disparity. And those disparities include access to higher level of care or adequate supportive housing and substance use disorder. So what we've done to really mitigate some of these disparities is to really enhance and improve our system of care. And one of the ways that we've done that is to really introduce programs and services that are aimed to really solving these issues, not necessarily just mitigating them. And for example, Bakersfield American Indian Health Project had the flexibility to create MOUs with some of our most well-known hotels here in the county. And that eliminated the disparity of really having to go through a series of qualifying sort of if you will, qualifying for supportive housing. We know that sometimes faith-based organizations, though they are a answer to some of the homeless issues, sometimes individuals may not qualify. And so the hotel setup was really a way of really, if an individual came to us who needs, and we get this often during the weekends, hey, I need housing, I need these supports now, I want to get off the streets. We have an ability to just put them in housing right then and there. We don't have to make assessments, whoever that might be, if they're American Indian, whether they're a patient of ours or not, they can get that housing right away. And then we connect supports right then and there with food, anything else that's immediate. So just to share an example of how we kind of solve those issues.
Evelyn, I want to invite you to chime in here and share some of your thoughts about what the top 1 to 3 issues you feel are most urgent and important to address from the listening sessions. Oh, I think maybe Evelyn has maybe stepped away. Are you there,
No,
Evelyn?
I'm there. I'm here. The top 3 issues for us are co-occurring disorders, psychiatric disorders. Housing is a big issue for some of our Native clients. So for me, I think the biggest thing we did was set up like immediate services when we have clients that have emergencies or need emergency housing due to being homeless or pending residential placement for substance use. We do have some excellent hotels we're working with, and one of them actually allows for food to be purchased, and the hotel will purchase the food for our clients. And that helps alleviate some work on our end. And they do a great job, very cooperative.
Thank you. Thank you so much. So I'll go ahead and pass it to Natalie to share about what you feel are most urgent and important from the listening sessions.
Thank you, Carolina. And like you said, good morning, everyone. This is Natalie Santamaria. I work with Visión y Compromiso with the network of promotoras and líderes comunitarios here in Kern County, but I also work in Tulare and Madera, which are here in the Central Valley. And my pronouns are she, her. So from the listening sessions that we hosted, there's a lot of things that are urgent and important. I think, you asked us to name 1 to 3, and I think I will have to begin with the stigma and education. And I know that's something that we continue to hear and we continue to lift up, but we really need to continue doing that. It doesn't stop in a forum. It doesn't stop in a conference. It doesn't stop in one workshop. It doesn't stop, right, with just a few events, because we have a large community here of immigrants, of Latinos, of indigenous communities. And, we just heard from our Native American, there's such diverse communities that, again, it doesn't just stop at one event. So we need to continue that. We need to understand what stops our communities from accessing these services, the pride, the shame, just figuring out systems. For a lot of our immigrant community, the system is completely different from our countries. So, the language comes into place, which is another issue that we saw is very important. Not only language access, but cultural competence. We don't only need service providers to speak the language, right? We also need them to have lived the experiences. That would be ideal, to really understand why the culture does not access services, why they miss the appointments, and stop stereotyping. I have heard so many doctors or providers say, we give it all to the community. They don't want to come because they just choose to. They miss their appointment because they simply choose to. Transportation is there, the time is there, but they don't really go deep into, if you are making all of that available to them, why are they still not coming? Because the need is there and they bring it up. That's what we learn in the listening sessions, right? So that goes into access as well. The need is there, definitely. We need to dig deeper into access, and that means language access, cultural competence, also proximity and availability of providers. We're in rural communities here in Central Valley. It's mostly rural communities. We don't have specialists that are close by that people can walk to. Transportation is definitely an issue, and distances can be up to 30 minutes. So that is an impact. And when you also don't have a good transportation system, public transportation system that is also accessible, all of those things come into place. So we're not only, right, I started with the stigma. So once we can overcome that, but we still have other blocks on the way that we need to overcome. And we need these entities to understand and really, really go into the communities and ask them directly what is needed. How can we come to you instead of them coming to the service provider?
I see so many other people listening intently to what you're saying, Natalie. And I want to, highlight that connection to other people's experiences and listening sessions. And I want to go ahead and pass it to Sang to share a little bit about their listening sessions in Butte County.
Okay. Thank you for the opportunity. And this is Sang with the Multicultural Center here in Butte County. My pronoun him, his. With the Multicultural Center in Butte County, we pretty much serve from Butte County. It's about many of you may know, but it's about 70 miles north to Sacramento to the north. And for the past, what we have done, we have a couple of the session. Iraq, our partner was helping us. So we coordinate and to ensure for that Multicultural Center is outreach and also execute the listening session and the events for that. And the organization is only the organization that provide culturally appropriate, language appropriate for the community here in Butte County. And that is we have been here for nearly 20 years with the community here in Butte County. And something that we found out at the listening session was to have a similar issue as our previous partner have. We have the language issue. We also have a cultural issue, and that is something that will really happen to here in Butte County. And also, we also have some, a lot of the community members, the participants also known that, they don't really know so what kind of serve that, county and the behavior having served. And when we asked to about the processing, the 3-year plan or those process for the community, our community member, and they also haven't, heard that as well. And this is some kind of issue that or some kind of challenge that we have here in Butte County as well. And that, and the most important, what we really urgent something that is the lack of outreach for the community for process and feedback of their program, mental health program that we have in here in Butte County. And our community haven't know, as I mentioned earlier, we look at the availability and service that is for the community. Oftenly, we don't really have much of the language access to this service. So that is what we haven't found at the listening session or the session that we have been complete with the community on Zoom.
Thank you, Sang, for uplifting some of those themes. And You pointed out how unaware some of the community members were of the community planning process and stakeholder engagement. And I know that was a theme for several of you, varying levels of understanding about how to get involved with the design of mental health programs, lack of awareness, a desire to be included, but also distrust too about how their feedback would be incorporated. So thank you so much for highlighting that really key theme. I will go ahead and pass it to Jody and Kamoya to share about their listening sessions and what they feel are most urgent and important to address. And I just remembered, as I was saying that, we have a Q&A. So if folks have questions in the audience, drop them in the chat. I didn't say that at the beginning, so you must be wondering what to do with your questions. Drop it in the chat, and we'll take a couple of questions at the end. So let me go ahead and pass it to Kamoya and Jody. Jody.
Thank you. I'll go ahead and introduce myself and then have Kamoya introduce herself. Hey, everyone. It's good to be here with you. My name is Jody Geddes. My pronouns are she, her, they, them, and I serve as a healing services manager here at Restorative Justice for Oakland Youth, and we serve in Alameda County area, although some of our other work takes us international as well as on a national level. Kamoya?
Yes, I'm Dr. Kamoya Johnson. I am one of the co-program directors for Restorative Justice for Oakland Youth, and I am here in support of this wonderful person, Jody Geddes, so I will chime in as needed.
Thank you, Kamoya. So I'll say quickly, our work at Restorative Justice for Oakland Youth, in short, is really about creating space to bring voices on the margins to the center. And we do all of that through an Afrocentric Indigenous lens. And so we infuse things like ceremony and ritual into our spaces as a way for us to first drop into the body so that everything isn't in the head. What does the body carry and what does the body speak? And so there are many different ways we incorporate that also as a part of our listening sessions. And so it's something we do naturally. And so even in that space, making sure we're doing check-in, we're focusing on our breath. There's a way for people to exit the space where they don't feel like they're carrying a heaviness or a wound that we've opened up. I very much agree with a lot of what folks have been shared based on the feedback and responses from community members. Natalie, as you were speaking, I was just like, do I really need to say anything else? But I will say a few things, and I think other folks touched on it as well. I think three things came up very clear for us. One was the inability for systems of care and some providers to really listen, hear, and respond to the experiences and challenges of many of our community members. So either having to kind of exaggerate something or having to play down the experiences that one is having so that they can get access to care. This was important for us to highlight because our listening sessions, there were three populations that we were holding space for. So formerly incarcerated folks, Black women and girls, and queer and trans people of color. So there's a spectrum and a range of experiences. And so there are different ways people have to kind of play up what they're experiencing or to play it down for them to really be listened to and for them to truly be heard. So even for folks who are service providers that are attending these listening sessions, saying, while I'm trying to create this pathway for others, I might not be engaging in that pathway for myself because the feeling of not being listened to and not being heard when they're naming some real challenges. In our Black women circle, a lot of folks brought up how that has led to a lack of diagnosis or misdiagnosis with some of their challenges, whether it has been mental and physical. And so we're talking about a real physical health impact to one's well-being and how they're able to walk through the world. So that's one. And then the other piece is this relationship between kind of addiction challenges and mental health and wellness that other folks named in things like dual diagnosis, right? That, you know, you can enter into a program or seek support for one thing, but maybe not the other, right? Which doesn't create space actually for someone to be successful in one area. So even when we think about housing, we know if that someone doesn't have housing, they're not focusing on these other areas. It doesn't mean it's not important. And I think often systems of care say that it might not be important to people because they're not showing up. But if I don't have housing, how can there be an expectation for me to show up and be well in that space. And so that's one of the things we found really coming up, the inability, I think, for systems to hold nuance. And I'm going to say it, this is based within white supremacy and the history of this country, the ways in which it is very much monolithic or, has to be one or the other. And people's lives are more nuanced than that, especially when we're thinking about the care that they're needing. So how do we hold the space for all of it? And when as practitioners, we don't have the answers, we build relationships and partnerships with spaces that do. I think I'm getting into the other question. And then the third piece, I think, is just accessibility. Once again, kind of knowing where those spaces are, but also creating scaffolding for people to get connected. So even people who show up really well, I don't expect myself to just give them a number or, a website link and that they'll go to it. It takes so much more effort and work than that. So how do we make those supports really, really accessible for folks? And how do we also not create a space, and this came up in our formerly incarcerated group, where people have to choose between work and connecting with a therapist, although there are laws to protect folks. If you have been formerly incarcerated and there's a stigma that someone holds about you, what happens in the case where you kind of name, well, according to this, these are my rights and this is the space that I need, right? And so folks talked about that, having to really choose between getting mental health support or their job, right? And we know over time there's a real, once again, impact on people's ability to show up to either of those spaces. And so those are three things that very much came up. And I think I just want to name, once again, even if someone can enter into a resource, stigma, I think that most people name, still continues to come up, that there's still a stigma that is held about folks. So is there listening and comprehension happening? Or do we just say, okay, say all the things you want to say, but I'm not going to take your concerns into consideration? And it can be a revolving door. And I think even in the space of the pandemic, people kind of coming in and out and practitioners having some real challenges, but we still have to create space for the humanity of others while we're trying to hold our own. So those are some things that came up. Is there anything you want to add to that, Kamoya? All right. Sounds good. Well, thank you all.
I saw so many other people nodding and shaking their head, and I want to open up the space and see if there's anyone that just wants to do a, yes, that resonated with me, or something I would like to add to what Jody and Kamoya shared. Please feel free to chime in.
It definitely resonates with the other communities. And I think that's one of the things that we also learn from the listening sessions. We're not isolated. These are not isolated issues. All of our communities face the same things. And I think this is a great opportunity for us to start coming together and really joining forces to speak up for all of us.
Angel, were you going to unmute yourself? Yes, please.
Yeah, I just did. I agree. I think, even when we look at the Native American Indian communities, they're very diverse as well. And they're, even within the Native American community, we have members of the Native American community who are married into Black, to African American, to Asian, to white, to Hispanic, Latino, Mexican, and even other indigenous communities. Kern County as a whole, and I think the whole state of California, wherever you live, you see this more now than before, where many of our communities are very diverse in race and ethnicity. So, one of the strides that I think has helped us is to really collaborate with the partners that are aimed at solving some of these similar issues, because that brings really sort of a holistic approach to healing as well, right? If other partners are strong in other areas of services, why try to recreate that? And I think that's echoing Jody's comments, is that we're all in it together. We're all in the same space in a sense. We're all trying to serve the same issues we're all faced with within our diverse communities. So the more we work together and the more we collaborate together and learn from each other, I think the better off our communities are going to be, because those communities include all of us, all shades of color, all races, all ethnicities, and all of these similar challenges that we're all being faced with. Thank you.
Thank you so much. Same, please.
I also like to add to that with the Hmong community we have two different generations. For example, with the older generation, when the approach or the culture that they believe is really different, with our younger generation here in the United States is different. That's the two approach. And when you a person who is a approach or reach out to these people, you have to have some kind of background of the family or the culture or the language or something like that to be able to reach out to the elderly population. For example, the older population, they have been facing so many issues, really tougher issue back to where they came from, such like with the Hmong or a lot of Southeast Asia community came to the United States is because of the Vietnam War, and that's bring us to this country. And they have been faced the Vietnam War in their home country. They have faced the issue when they're put into the camps and come to the United States. Here, our elderly don't really know how to read and write, the culture, the language, and also the everything you might say. Often we have elderly that who walk in the street and he just remember on the plum tree that he coming back, have to remember the plum tree to coming back home. And one of these days, they took down the plum tree and he lost. He could not get back to his home, and until the community member and family have to call to the law enforcement to search for him. Where is him going? Because he said that, well, I'm come to remember the plum tree. I don't know how to read and don't really remember the street. And this is something that's is a way of to reach out to this population, really young population, to the United States, even though we've been here for 40 some nearly to 50 years, but everything just pretty new for us, very new for us. And also nowadays the issue that we face now, our Asia community, it's really have a hard time to do the exercise, walk in the street, something like that. So this is something that I just like to add that to that, because this is something that we, even though we have one community, but we have a two culturally in the community as well, for the family, for the elderly, and for the young.
Thank you so much for pointing out the different experiences of different generations. And the plum tree, I won't forget that story. I know so many of you have those stories in your mind of individual experiences, a lot of which is reflected in greater detail in the report, but to hear directly from all of you is a different experience for our audience. So I'd like to move on to the next question, and want to hear from you, Angel and Evelyn, about what 1 to 3 lessons you've learned about making listening sessions accessible for people, trauma informed, and culturally appropriate. Angel, you're muted.
Sorry, there we go. I forget that I place myself on mute and then I'm not on mute. But to answer your question, I'd like to start with just sharing a little bit of the historical context. Many of us migrated here first, but for the Native American people, I really love this quote from our local tribe, the Tejon people. And Chief Juan Lazada, he put a really beautiful quote that I think sums it all up. He said, "We were here on the first day the sun came up." And we have to understand where the Native people have lost a little bit of their identity. And that's where I feel we start. We start by working with our population from the cultural and traditional lens, so that we add value back to the traditions that our Native American people had. And we're finding that the more we include cultural and traditional care, it really allows for evidence-based practices to complement the care and the wellness for our people. One of the things that we have done really well is to introduce drumming. I have a small drum here, and the beat of a drum, it really allows for individuals to feel the wellness, to feel it in a way that goes very deep in their soul and takes them back to the first day, to those days of their ancestors. And other ways that we inform trauma, and trauma comes from, for many of our people, the generational trauma, right? We hear about historical trauma and generational trauma for the generations and the generations, and we see that play out even among our youth and our kiddos. And part of us really being proactive and including holistic approaches to care is by bringing tradition back into our practices. So, for example, if you come to our clinic, anyone that comes to our clinic is offered smudging, and we use sage and we give sage out to our patients or anyone who visits. But the practice of saging, our sacred way of saging, is done by our cultural coordinator, Ms. Donna Cubitt, who is also a counselor, a substance abuse counselor. And so we walk those individuals through that process because we understand that the purity and purifying ourselves daily is one way of us being able to become more open. So those are just a few, to name a few, and I'll pass it over to Evelyn if she wants to talk a little bit more about just the different types of evidence-based care that we offer here at Bakersfield American Indian Health Project.
Thank you. Oh my goodness, we offer so many services here. We always focus on generational trauma because our natives have experienced that through the generations, and current traumas that are going on in their lives, physical abuse, aggression, just a variety of different things that happen to an individual, loss of employment. And then we look at talking with them and trying to pair up the appropriate evidence-based services to provide holistic care with them, along with our smudging, our drumming, song and dance as well. We provide trauma-focused cognitive behavioral therapy, eye movement desensitization, reprocessing, EMDR, motivational interviewing, solution-focused therapies. There's so many of them. I could go on and on with them. So we do try our best to provide holistic services. We have a RAP individual here, Abigail Dotson, and she provides wraparound services. And we also engage the youth in youth prevention services too, to help the whole family. We provide home visits and transportation services. We try to wrap around every service we can think of for our clients, and then some. We provide food referrals, rent and utility assistance. We try to do as much as we can. And we always want to include our cultural healing traditions, such as smudging, drumming, song, dance. We offer smudging to anybody that walks through our doors if they want it. So I think that's one of the best perks. Excuse me. We also have had requests from other agencies to come and smudge their buildings to rid them of bad spirits, or just they're not feeling comfortable in their department or their building, so they want us to smudge it and help ease that tension a little bit for them. So that's some of the things we do.
Thank you, Evelyn. Yeah, providing the full scope of services, both in a community defined way, as well as merging them with the evidence-based practices, is such a key strategy to making services accessible and trauma-informed and culturally appropriate. I'd like to pass it to Natalie now.
Thank you, Carolina. Such great opportunity and information that we're sharing here. So, again, one to three lessons that we learned. I do want to highlight one, and I've also been looking at the comments. And this is that the education needs to come from community to the community. For example, promotoras, that's what we work with, not the agencies. It doesn't resonate with the community when it comes from agencies. We really need to start integrating this community leaders, again, promotoras, into the system to be able to then make everything accessible, trauma-informed, and cultural appropriate, right? So what we did, this is not something we've learned. That's something that we keep proving that it works. For our listening sessions, I integrated our local chapter of promotoras here. They were part of the planning, putting together the questions we were going to ask, inviting folks. And what we also had to do is have 2 different listening sessions. And we did this very intentionally because we wanted to have the indigenous community. We have a big Mixteco community here in Kern County, from other places too, but I think that's the biggest. And we had to create just one space for them because we really wanted to be, and not to isolate, but to really be inclusive and have that time dedicated to hear them, right? And what is to them relevant in these questions, the accessibility and all of these things. Then we had another listening session with promotores and some members from Líderes Campesinas that were, that's how we were able to find the commonalities and all of this. So we did have to again create both of those spaces, but to in the end combine them, just like we're doing it here today, right? We all had our own listening sessions, but here we are sharing and finding the commonalities that we have. And that goes to resonate again with what I said, is not an isolated issue. That's something that we learned again, we need to be transparent and have a clear ask because it's a very sensitive topic for communities. And what I mean by that is we invite community folks to come to these listening sessions. And, it sometimes is very difficult because community is tired of feeling like a token. They say, okay, you're going to come in, you're going to pick into my brain, or you're going to get this signature, you're going to get this, and then what? Right? I still see the lack of. I still see things not getting done. And that's all over the place, right? City services, anywhere. It's the same thing. So we really need to we had to be very transparent and tell community, what is it that we wanted this listening session for? To gain their trust, right? And so they know that this is what we need to do in order to make that policy change. But we need to have them involved and keep them involved in all of this, because that's when we're also going to get them into the advocacy part and really get this moving and making policy change. So that's something that we had to put, again, be very upfront, right? This is something for the long haul. A listening session did not mean that by tomorrow we were going to have all of these things being addressed, but it was a step forward to that. And, there's still a lot of work to be done. There's still a lot of work to be done. But like I mentioned earlier, there's a lot of opportunities. There's a lot of opportunity to begin the conversation around promotoras in this healthcare systems and how they can be that bridge and that liaison into communities. We really need to start highlighting that. And, the promotor model works, and there's been studies on that. It would be great. It is so great when we see programs where it is that community leader who has that capacity of going into the homes, being, I don't know, in a barbecue, at a store, right? People come to you, they express these needs, and how wonderful is it that a promotora is able to refer you to a support group, refer you to someone that they know it's going to follow through, and that promotora is following through. The person has the direct number. Hey, they're not answering. I'm not able to get services. And the promotora keeps following up and following up. That's also what's needed and what we learned, that promotoras need more tools to keep helping the community because the need is there and the wanting to help them is there. We just need, again, for these big agencies to really understand and embrace that community experience and take it on and make it a whole package. So it can be, holistic, like a lot of people are saying in the comments. that would be the holistic approach.
The word that came to mind, it's not the word you said, but the word that came to mind to me is accountability. It doesn't stop at the event, which is how you started your remarks. And it's just a theme that came to mind. Sang, what are 1 to 3 lessons that you learned about making your listening sessions accessible, trauma-informed, and culturally appropriate?
Yeah, we with the listening that we have really try hard to get the listening and going on, to do that, and we also have our a community leader who is really expertise both for the Western and Hmong culture, and he is really expertise. He's our keynote speaker today, Dr. Zhang, who's the facilitate. We asked Dr. Zhang to facilitate the listening session because here it's here's not the only community that when we trust by the community, but he is really expertise for both Western and among the traditional culture, and we do believe that to have a really expertise for both and trust by the community will help the community member to share what's it's really neat in the community. So Dr. Zhang didn't, help us to facilitate both the listening session, and he is really expertise for that, and be able to explain and be able to gain some of the community trust and to do that, because in the Hmong we don't really have mental health. Mental health is something that is really new for us. When we're talking about mental health or talk about health, that is really sensitive in the Hmong community. Now, our parents, our mom, dad, and uncle, aunt, we don't really talk that at home. So because I don't know what really happened, but we don't really talk that at home when we talk about mental health, when we talk about health. That is something that really sensitive. And we really need someone that who really expertise not to go directly, but to not to go directly, but to explain and to I might say go to get to the points. And Dr. Zhang is a person who is really fixed on that for both, because they can have that, and also to share and to be able, when we have someone that who is trust and also expertise for both the community Western and also the tradition, and that it's a pretty help. The session went well with Dr. Zhang and with the Sirac and Hmong Cultural Center, and we're pretty went well with that, and who it's better to share with us to understand what's what's the kind of resource and what should be better, what should way to improve, something like that. And that's what I mentioned earlier, that we have both the younger and the younger generation, the older generation, both approach differently and also need also differently. And one of the kind of issue that we have when doing this kind of lesson session in Zoom, we also find out that our community is pretty lack of technology, and we're pretty behind. Mainly for the elderly, those who really want to participate, they don't really know how to get to the Zoom, and there are too many number to get into the Zoom, and that is an issue that we have. And also, they don't really know, even though we teach them, or do we said earlier, awfully said that you have to mail, plus this number, you will mail yourself, and plus that number, you will, unmail yourself, or you can talk. And that is some issue that we have in the Hmong community. But the good news is that after we found that this is the kind of issue, the Hmong community was apply for the a grant. Now we got a grant to educate the elderly, supposedly the elderly, to know how to do that, especially for this time of the situation that we have. We often have some elderly, that one person in the home or two person in the homes that, with the COVID and the daughter, son, not really often coming to visit, but we're pretty afraid that, the elderly, the immune system is not that strong. For those younger daughter, sister, or brother, sister, daughter, son, they're working and they were afraid that they will bring the COVID to the mom and dad. They only talk to the phone. They don't really see their face for months, something like that. So this is some issue that we have, that what we find out that technology is an issue, and also culturally, and also we have a cultural issue in the community as well. For example, we also found that a number of people would like to see more, cultural activity. We will see more people, servers that who be able to understand the culture, to be able to serve and be able to provide, interpreter or cultural staff at the site for the community. And I think that is what we found at the listening sessions.
COVID is such a huge accessibility issue, and many of you had to struggle with, are we going to do this event virtually? Who's that going to exclude? Are we going to do it in person, hybrid? That was such a huge issue, on top of, just learning how to get online and all the numbers that you have to get, passcodes. It's like, it shouldn't say phone number, it should just say barrier 1, barrier 2, right? I mean, it's just so hard to get online. So I'll go ahead and pass it to Jody and Kamoya, and I'm getting intelligence from my tech person that we have lots of questions. So gonna just let the speakers know we've got some questions. So I'll go ahead and pass it to Jody and Kamoya.
Yeah, thank you all for that. I think I'll try to be quick. What I'll say is, Sang, I really appreciate what you shared, because it makes me think about language, and language is something that's so important. When we initially looked at the questions, I think as a group, if I can say this, I think we were like, oh no, right? And we probably did push back. And so when we brought people together, actually the first question was, what are your first experiences around mental health? Like, very much vague, because it created space for people to reflect on their upbringing, early experiences in life, and later experiences. And I think so many times it can be quick to go to the language of trauma, and that can feel jarring, because the assumptions around what trauma is, right? And sometimes it's only in most recent year that kind of trauma theory work is talking about historical trauma and generational trauma, right? And that systems can perpetuate trauma, right? So when we think about poverty and houselessness and how that fits into the trauma that some individuals and communities are facing on a daily basis, that is often left out of the narrative, because it means we have to continue to hold systems and structures accountable. And I think that was a really important question, because I remember in some of the listening sessions, it actually created a pause for some people, because they began to say, I didn't recognize earlier on in my life that this is what mental health looked like. And also the recognition that mental health is a spectrum, and some people even named witnessing their parents have mental health challenges as they moved across that spectrum. And it was the first time during the listening session that they were reflecting on that experience, right? Rather than me coming in to say, how can the county, or how can these systems fix mental health? How can we do put it into the box of therapy or just counseling and what we see as these traditional, although, we can talk a lot about language when we talk about tradition, right? But what we see as kind of this Western way of engaging in healing and engaging in care. And so I really wanted to create a flexible and open space for people to begin to define those things, So that's one way I was able to hold that space. And I think another way was not to correct people's experiences, saying that as a Black woman that's in service to and with people of African descent, where we don't have monolithic experiences, although it can be assumed, right, when we think about history of racism, and that someone might share a particular experience, then I might be like, oh, I don't really believe that, but that's for myself. It is not my space to try to correct one's experience. And that people in space were able to disagree with each other. And because we use the restorative justice circle process, that is rooted within Afrocentric and Indigenous practices that create space for all to share and to show up in whatever ways they choose to show up, that it is not pre-described. People were able to go back and forth, and it was beautiful to be able to witness that. One group, we went over time significantly, but it was this beautiful moment for people to really share their different experiences that led us to a place of where do we go from here and how do they be a part of that moving and shifting. So I think language is something that's incredibly important. And so with all the questions, creating space, yes, to get feedback, but also not being so focused on what feedback I can get and bring back to systems of care at the expense of creating space for people to really and truly reflect on many of the experiences that they had. And so that's one of the things that I found happening. And honestly, you know, at Ardra, one of our values is radical hospitality, something we learned from some of our partners out in Chicago. And it's hard to do that when you can't have like a full meal together and break bread, but doing things like I have a playlist, you know, and we play music at a lot of things we hold. So as people are coming and they're mingling into the space, playing music, it shifts the dynamic. Like it doesn't feel cold, like you're coming for a listening session, but it feels like a family reunion, right? So playing music as folks are coming in is one of the things we did. Offering gift cards, honestly, for people's service, because the pandemic space we're in right now, a lot of services require people to be in crisis, and sometimes our people are not in crisis, but what does it mean to still provide an offering? So we were like, you can get a DoorDash gift card, show up as you are. Some people wanted to donate the gift card to young people in the community. And so these are just some of the ways we were really creating a space that was warm, welcoming, and a space that was honestly really inviting. So we spent significant amount of time on check-in and opening, similar to what Angel named, really digging into the breathing. You know, some people are like unloading groceries, coming from work, driving, and they were like, is it okay if I'm doing this? And we're like, absolutely. You know, as long as you are safe in whatever it is that you're doing, you can show up in this space in all of that stuff. And so that was the kind of space we were really holding, not really being concerned with time. And that's one thing I want to name that I think is a part of our first two questions, that sometimes there's such a concern with time and urgency, and healing takes so much more than that. And so many of our communities who are on the margins can get left out. Because the other stressors that people are dealing with that are not of their own doing, but a particular kind of history. And I think that's important to name, because what happens is there's direct harm that systems of care are perpetuating. And this isn't to beat up systems of care. I know many great practitioners, but we have to continue to peel back the onion and reveal the layers that exist, right? Because we were talking about real human lives. It's not like a Netflix series. This is what people are continuing to live on a daily basis. And so for me, it was really like, come and just share whatever it is that you want to share. I'm offering some questions. It is an invitation, but there is no obligation to meet my need. This is a space to be held for you. And it led us to also moving forward, having more listening sessions more frequently. And our people share honestly. You know, they're not really concerned with pleasing us. So that's one of the things that's really nice. But recognizing that it was also an opportunity for them to come together in the midst of so much and to reflect. And I think it also helped in terms of the COVID-19 challenges people are having, that, you know, when you're in community, you can show up well often. And because we're moving through things, there might not be space to actually reflect on the impact. And so even in our check-in, folks were like, whoa, I didn't pay attention to this thing happening in my body. And that brings, you know, when folks were naming some of the services, so we were like, okay, we can offer a circle of support and accountability, but we also have these other circles that you can join to be a part of community if you're feeling like you're on the margins right now and you're just kind of coasting through things, or, hey, let me scaffold you on this referral process. So it didn't just begin and end with a listening session that felt extractive, but we were really creating community. So I think, in short, it was really treating the space like a family reunion. And if I entered into it already seeing kind of the use of Zoom or any kind of social platform as a barrier, I would have already been putting up a wall, right? Because I would have already been like, I know we can't really connect, but I have a different belief that, Zoom and a lot of other platforms give us, as we meet the access needs, it does also open up a space for us to bring in folks who may have never been able to join the conversation. I think about being in person. Sometimes people have to drive, pick up kids. I mean, even some of our other circles that we're meeting in person, folks are going to be like, I'm going to be an hour late. Is that okay? Yes, come as you are. Similar to what Sang named, we had a lot of people that called in, and that was also okay. Or they called in at first and then switched to another device. So I think it was just creating a space for a multitude of different responses and feelings, and not making it feel so heavy as if they had to solve all these challenges. But here's a space that I invite you to share your experiences and what's coming up for you. I'm not sure if that answered the question, because I forgot it halfway through. But Kamoya, is there anything you would like to add as well?
I just want to reiterate and highlight the aspect of holding multi-generational spaces that can hold, that people who experience complex trauma, vicarious trauma, all of these things, and how holding multi-generational spaces can really help folks expand their thinking, bring all of their experiences, their perspectives into one space, and really truly listen to another person. It's not about agreeing, like Jody said, necessarily agreeing with that other person, but actually expanding your thinking around what can I use in my life to help me heal mentally, physically, all of these aspects, and thinking about the systems of care. And just personally for me, my father has Alzheimer's, so we go with him to his doctor's appointments, and how powerful that is. And the doctor's like commending us for showing up with our parent. And this is how the systems of care should be, right? It should be family members can actually go into the office and actually support their family member, whatever age they are, so that we can not only partner with the systems of care, but we can also interrupt a lot of things so that we don't have to end up actually in that doctor's office. So I just wanted to add that piece, and I'm going to be brief. So thank you.
Thank you. No, thank you so much for expanding upon the nuanced issues and themes that Jody shared, and I just want to thank all of our panelists for sharing a snapshot of some of your takeaways and some of the what needs to continue beyond the listening sessions, both in terms of approach as well as advocacy too. And I want to turn it now to a couple of questions from our audience. So I'm going to do some opening tabs here because I've got a special place where I can access the questions. And I'm going to take a couple of questions here. I want to thank everyone for asking these questions because, just want to thank the brave people who shared some of their thoughts. I want to, so Natalie here asked for Kamoya and Jody, if you could speak to one of the mental health needs of Black men and boys. And they shared that they're often left out of the conversation entirely, although they are impacted the most by mental health inequities.
Yeah, definitely. Thank you for that question. And I think that we have over 8 restorative justice circles that meet weekly, and we try to be really intentional with our listening sessions about what circles we were inviting to be a part of the conversation, because it can be easy to say, well, this circle, this group, of course, right? And we're always talking about having these conversations all the time. And that's one of the reasons we wanted to hold space in our formerly incarcerated people circle, because I think, once again, we're thinking about community members and people who are on the margins. And that circle is primarily of Black men as well as boys. Sometimes it's an intergenerational space. And I think one of the things that came up was around kind of emotional intelligence. When I talked about people's first experiences around mental health, a lot of the responses people shared is not being able to have a space or a network of support to be able to understand one's emotions as they were having certain experiences in the world. And there was a way, one, they were stigmatized, but also blamed for the circumstances in which they've come from. I'll continue to name this. We're talking about a particular history that has come before many people. And so that's one of the things that really came up in the group. And even as folks were expressing things, they named how, when we're talking about solutions, wanting to be bridges for other Black men and boys in community, so that, because we recognize there's often a breakdown in multi-generational healing, a breakdown in kind of multi-generational building due to this kind of historical context. And so a lot of their solutions was really, how can I be a bridge to be able to share my experiences? And I think Natalie and Angel brought this up, really being able to share one's experiences so that they can support other generations as they are on their journey, and also be bridges with systems of care. So even if we're challenging these systems, recognizing that we can also be bridges between them and the community. And to name, a lot of our work really is thinking and centering the voices of Black men and boys. We also have a Black male circle. So even in that space, not just stopping at the listening circle, but here is this other pathway to continue to be in community where folks are having challenging and complex, of course I'm not there, but I know that they're having challenging and complex conversations as well. So that is always a priority for us. And, you know, that formerly incarcerated people circle was, once again, another space highlighting the need to have some of these deeper conversations. And also, once again, think about our language right now. We know that in social media, the talk around like what is masculinity and toxic masculinity has been huge. And there's an underlying anti-Blackness to Black men that's a part of that conversation that I think doesn't get brought up. Like, who is associated with toxic masculinity and what image is painted, right? So what does that mean for a young man that's trying to understand where their place is in this world, right? Who stands in that masculinity and power, but there is another image that is really being depicted. And so we really try to hold that space for people to show up as they are. You know, so like, is somebody gonna show up Saguenay pants and with grills? That is who you are. Show up as you are. Like, we don't want to carry that baggage that is really pulling people down and is a cost to their life. And so in all of our spaces we hold, you know, this is an invitation to be who you are or who you aspire to be. And how do we create a space to hold that? And that's hard and complicated because sometimes you have to have some hard questions as the elder in the room. And so for us, it's always a part of our work. And it's something that was very much highlighted in our listening sessions, particularly around kind of emotional intelligence and kind of family dynamics. How do we support not just the person, the young man or adult that needs that support? And the last thing I'll add, love came up a lot. People in their adulthood are learning how to love. You know, we talk a lot about, you know, folks like R.G. Lord and Bell Hooks and how they've passed down lessons about what it means to love. And so we had some talk about creating a community to really rethink and reimagine the ways that we can be in love with each other. And what does it even mean to say, I love you? Like, that's hard. It seems simplistic, but to really say, I love you in a way, I'm like getting emotional, Jesus, in a way that is like so deep that you can see all of someone's humanity when there are spaces in the world that cannot hold that, you know? And I think that's why I try so hard in our work to really create that invitation. And sometimes people are like, oh, really? I can say that? And we're like, yeah, do your thing, you know? And even going into like, do we record this or do we not? You know, what do we keep? What do we leave out? Because we get to define that space. No one else gets to define that for us. I don't remember the question, but I'll pass it back over to you or Kamoya if there's anything you all would like to add.
No, yes, I think that was a thumbs up or a star. So we are running, speaking of time, and having to adhere to the dominant structure of time here. We're over time, and I just want to say to all of the audience members who've asked all these questions, we want you to connect with the people who just spoke. So, in the post-event survey, you can say, yes, I would like to be connected to Our Joy. I would like to be connected to Visión en Compromiso. I would like to be connected to Bakersfield American Indian Health Project. I would like to be connected to Hmong Cultural Center of Butte County. So please do that, because I want to make sure that you get connected to these people as mentors, as advocates, as any areas where you feel like I really want to connect with that person and what they do. And just to give you a sense, speakers, of the types of questions that were coming in for our audience, I know we won't have time to get into them, but I want you to get a little peek of what questions people are asking. So one person asked, what will the role of community health workers be to help reduce disparities in mental health? That was from Del Greta. Bobby shared, I appreciate that you are talking about supports and scaffolding. When that does not work, what mental health crisis response programs deserve to be modeled that are not law enforcement based? Wendy said, or asked, did any groups involved in this research project experience with resistance within their respective counties or within the general community? And then Maria asked a question I'm going to try to say in Spanish. I'm going to embarrass my mom, but she asked, ¿cómo se puede abogar por un adulto que no puede decide por sí mismo? How can we advocate for an adult who is unable to make the decision for themselves? So people are really looking to you for some guidance here. And yes, so we'll share these questions as well in written form to all of you. And for the audience, please, again, complete the post-event survey, and you'll be able to also read so much more about the themes that came up and the nuances that came up in the listening sessions through the Right to Heal report. So now what I'm going to do is direct, I'm going to ask that Jeffrey, our tech person, move all of our current speakers to the backstage or off stage. And, I should have said goodbye, bye, tech. Okay, and then I'm gonna ask everyone in the audience to join the yellow stage. So we're gonna move on over to the yellow stage, where we are going to hear from the statewide partners and their experience supporting all these great local organizations in their listening sessions and advocacy efforts. So let's move on over there, and I'll see you down the hallway.